Welcome to the Introduction of iView to Nurse Assistants course. This course demonstrates how to navigate and document in Canopy. As we standardize, simplify, and optimize our EMR, we are moving ongoing documentation to iView and adopting new functionality. This web-based training module is designed to introduce you to iView documentation and new functionality incorporated into your workflow. The objectives for this course are: use staff assignment, use handoff communication page, document on a power form, use iView to document patient care, document notifications in iView, modify, unchart, and change date time of documentation in iView, learn how to personalize iView, learn how to begin and inactivate dynamic groups, document tasks in the Activity View band, use categorization, use flowsheets to review prior documentation. Disclaimer: Canopy is regularly updated to include new features and provide additional information. The screen layout in the live environment may differ slightly from what is shown here and may include additional patient information. The majority of documentation for nursing assistants will be located in iView now. However, a select few will remain on power forms. An example is the CNA height-weight power form. Now let's move on to the first lesson and learn about selecting a patient list. A patient list can be made based upon location, assignment, or by custom criteria. The charge nurse has made assignments for today. Now let's build your assignment list. In the Organizer toolbar, click Patient List. The Patient List window is displayed. To modify your patient list, click the wrench. On the left, you may or may not see available patient lists that you have previously created. On the right, you will see your current active patient lists. For this activity, an assignment list has already been created. From the Available List pane, select Nursing Assignment List. Click the right arrow to move your assignment list to the Active List column. Let's make sure that this assignment list displays at the top, to ensure that it opens automatically when logging in. Select Nursing Assignment List and click the up arrow twice to move your assignment list to the top. To view your assignment list, click OK. You have now completed selecting a patient list. Now let's learn about staff assignment. Staff assignment. After selecting your patient list, you will need to create your staff assignment. Staff assignment is used to assign patients to an individual. Your staff assignment should be created at the beginning of your shift. You can adjust it as needed throughout the day. Let's demonstrate staff assignment now. In the Organizer toolbar, click Staff Assignment. The staff assignment window is displayed along with the shifts. You need to find your correct shift and select it. Today we'll select the 12-hour day shift. You need to find your correct facility and unit. View this demonstration as we select the training unit for the assignment. Click Save as Default, and then click OK. Click the Discipline down arrow and select Nursing. You want to assign yourself to your patients. Right-click the gray bar area at the top of the staff assignment window and choose Add Care Providers. The Add Care Providers box is displayed. In this box, you would enter your name. Today we are using a test user. Click Search to find your name. Drag and drop your name into the Assigned Care Providers box. Click OK. Staff assignment is displayed with your shift time frame. Now you can begin assigning patients and/or rooms to yourself. Select the correct patient or bed and put the bed on the head. When you have completed your staff assignment, click the Save icon. Select Patient List from the toolbar and refresh your screen. The patients assigned will appear on your assignment list. Now you have used Staff Assignment to assign yourself to patients, rooms, and beds. Now let's learn about the Handoff Communication tool. Handoff Communication Overview. Handoff Communication allows you to view all clinical documentation for your patient for treatment purposes. This overview will provide information about how to navigate the handoff communication. Components within the handoff communication are links to other pages in the EMR. You can hover over the section header to see what section of the chart the link will take you to once you click on it. Component sections can be collapsed or expanded by clicking on the arrow icon. The up arrow collapses a section and the down arrow expands a section. You can customize the layout of the components by selecting the Customize icon and choosing View Layout, Drag and Drop, Expand All, and Components. Selecting Clear Preferences will undo any customizations that you make. You can customize the color of the components by clicking the Customize icon located on that specific component. If you are not already using the handoff communication to review patient data, begin to incorporate it into your workflow to save steps with navigating to multiple areas within the EMR to view data. Now let's go over tasks on the task list. Today you have been assigned to care for 13 MRSA, a 27-year-old male. Let's review the updates to your tasks on the task list. There are now 3 different types of tasks displayed on the task list. A chart done, not done, which is a task without a power form, a task that opens to a power form, and a task that opens to iView called Activity View. We will review a task that opens to a power form in the new task type called Activity View. From the task list on the menu, double-click the Weigh Patient task. Notice this task continues to open to a power form. Document the patient's actual weight in kilograms, 90 kilograms. Sign to complete your documentation. Refresh to clear the task from the task list. Before we review the activity task type, let's review documentation using iView and the new functionality. From the menu, select Intake and Output iView. There are 3 main sections within iView: the navigator, the view pane, and the filter window. The screen is displayed with the navigator on the left and the view pane on the right. The navigator organizes information into bands, which are subdivided into sections. To select a band, simply click on the name of the band. Sections within a band will display in the view pane if they are highlighted blue. Think if it's blue, it's on view. Note, the following icons may display for the selected time frame. Black check mark. This indicates documentation has been signed in this section. The view pane is where all of your documentation displays in either actual or interval time frames. Please remember that if the section is not highlighted in blue in the navigator, it will not show on the view pane even if documentation is present. The date range bar at the top allows you to adjust the date time range that you are viewing. Blue text indicates reference information. You are now ready to document vital signs in the nursing assistant band. There are 3 ways to document in iView. Double-click on the time in a column to activate all sections highlighted in the navigator. Double-click on a section header to activate that section. Or double-click in a single cell to add one result. Let's begin by highlighting the sections in the navigator that you would like to document. For this patient, you will document the following sections in the navigator: vital signs, urinary catheterization, incision wound abnormality, peripheral IV, CNA frequent checks, and notification. Most of the sections above will already be selected for you. Double-click on the time in the first column. This will activate all sections that you have highlighted in blue. Let's start with the vital signs. Document oral temp 98.6, heart rate 88, respiratory rate 18. Click the green check mark when you are ready to sign your documentation. You can also right-click on a single cell and add result to document in the cell. Let's right-click in the cell for oxygen saturation and document 98%. Click the green check mark to sign your documentation. Note the black check mark appears next to the section you have documented in. Next, let's document the urinary catheter insertion. Document indwelling catheter. Notice that the urinary elimination and urinary catheter types are conditional fields. This is noted by the conditional logic icon. Conditional logic decreases the amount of visible text until it is needed. When an option is selected for a conditional field, additional fields will display on the view pane for documentation. Document the following on the urinary indwelling catheter. Urinary elimination indwelling catheter. Urinary catheter size 16 French. Urinary catheter activity type inserted. Urinary catheter insertion date T for today. The current time flows in and you can adjust the time as needed. Department unit, urinary catheter placed, specify unit type, type in the unit you are working on today, 3TC. Balloon inflation, 10 milliliters sterile water. Urinary catheter secured with stat lock. Drainage system, dependent drainage bag. Drainage bag location, below bladder, drainage bag off floor. Site condition, no complications. Urinary catheter output, 400 milliliters. The urinary catheter output volume automatically flows to intake and output. Click the green check mark to sign your documentation. You have learned how to document in iView and about conditional logic functionality. Now let's learn about dynamic group functionality. Dynamic group functionality overview. In this next lesson, you will learn the functionality of dynamic groups, which will be used to document wounds, peripheral IVs, orthopedic devices, and continuous passive motion devices. Disclaimer: nurse assistant certification levels vary based on scope of practice. We are not able to hide documentation elements in dynamic groupers. You should be documenting the items covered by your scope of practice. For example, all nursing assistants will be able to see wound documentation fields in iView, but only nurse assistants with special training are allowed to change wound dressings and document in iView. Your patient, 13 MRSA, has been assessed by the medical team and a wound dressing change is indicated. You have changed a gauze dressing to his left lateral leg. Complete the documentation of the dressing applied to the wound. Open the nursing assistant band and select incision wound abnormality. Let's navigate to find this dynamic group. In most instances, the nurse will have already begun the dynamic group and the abnormality type to display the conditional fields that you will chart against. This will allow you to chart the dressing change. Locate the dynamic group for the left lateral leg venous ulcer and chart. Dressing type, gauze dressing. Dressing activity, changed. Click the green check mark to save your documentation. When the information documented is too long for the cell to fully display, you will see an ellipsis behind the text. This indicates there is more text to review. You can hover over the cell to view more details, or you can expand the column to review more details. We will demonstrate expanding a column for you. You have documented a wound dressing change for your patient. Now let's review discontinuing and inactivating a dynamic group. 13 MRSA is recovering well and today he will be discharged. The nurse has asked you to discontinue his peripheral IV. In iView, click the nursing assistant band. Click peripheral IV. You will need to complete 2 steps. First, document that you discontinue the line, then inactivate the peripheral IV dynamic group. Double-click the column header for the peripheral IV time column. Select Discontinued in the Activity cell. When you select Discontinued, conditional fields for removal and removal reason display. Document removal, adhesive bandage applied. Document removal reason no longer indicated. Click the green check mark to sign the documentation. Next, right-click the dynamic group label and click Inactivate. You'll notice that the peripheral IV now has a gray background indicating that it is no longer active. Now let's learn about Activity View tasks on the task list. Activity View tasks on the task list. Now that we have reviewed documentation within iView, let's view task documentation in Activity View. Remember, there are 3 different types of tasks displayed on the task list. A chart done, not done, which is a task without a power form, a task that opens to a power form, and a task that opens to iView called Activity View. Let's document a task with Activity View. From the task list on the menu, double-click the orthostatic vital signs task. Notice this task opens to iView. Watch this documentation demonstrated for you. The task will drop off the task list when the documentation is completed. Now let's learn about customizing sections in iView. In this lesson, you will learn how to customize iView based upon your patient's needs and what you need to document. 13 MRSA needs to have his vital signs monitored more frequently since there is a concern of his condition worsening. The physician has ordered vital signs every hour and for his temperature to be taken rectally. You notice that a rectal temperature is not listed in the vital signs section on the nursing assistant band. Let's customize the band so that you can document the temperature. To begin, click the Nursing Assistant band. Click the Customize view in the iView toolbar. When the window opens, the bands display with their default settings. Here you can choose which items will display on or off view by choosing the appropriate box. In the Search for Item box, you can locate an item as they are listed in alphabetical order. Note, if the sections open in expanded form, you may find it easier to collapse all sections before searching. Under Vital Signs, find the section labeled Temperature Rectal Fahrenheit and click on the On View checkbox. Click OK. Temperature Rectal Fahrenheit now displays as an option to document under Vital Signs. Double-click on the cell for Temperature Rectal Fahrenheit and document 98.4. Click Sign to save your documentation. You have customized iView sections. Now let's learn about customizing time frames, categorization, and frequent charting in iView. Customizing time frames, categorization, and frequent charting in iView. Let's change the time frame interval of your nursing assistant band so that it will be easier to document Q1 hour vital signs. In the nursing assistant band, the time increment defaults to actual time. To update this time increment, click Customize View in the iView toolbar. Click the Preferences tab. Update the frequency to hourly on the nursing assistant band. Select Q1 hour for the default frequency interval. Note, it is possible to set all bands to a specific frequency by choosing All My Views instead of the particular band you are working in. Click OK to save your changes. After iView refreshes, the time increments are now set to Q1 hour. Now we will demonstrate documenting in CNA frequent checks for patient rounding. Frequent checks: family visitor present, patient in bed. Patient care needs addressed, CNA. Pain, potty, possessions, positioning, nutrition, hydration. Circulatory care, SCDs in use. New functionality called categorization exists in the range of motion fields. Select the plus sign next to the left upper extremity to display and select LUE active. Then right upper extremity and select RUE active. Now we will demonstrate documenting other frequent documentation. In this example, during rounding, our patient has complained of pain. You have notified the nurse. Let's document the notification in iView. Notification reason: pain. Discussion: patient is having increased leg pain. Nurse notification event: pain. Name of nurse notified: Beth Test. Click the green check mark to save your documentation. Now we will show available documentation in activities of daily living. Here you can document safety, activity, nutrition, hygiene, valuables and belongings, and task treatment not performed. Fields for documentation of use of an interpreter are located in the patient rounding section as shown here. You have reviewed customizing timeframes, categorization, and frequent charting in iView. Now let's learn about default open for sections in iView. Default open for sections. You can also choose whether or not a section will default open by customizing the view. Because you anticipate that you will need to assess 13 MRSA's orthostatic vital signs, change the settings in the nursing assistant band so that the orthostatic vital signs will default to open. Note, the customization will only apply to 13 MRSA, not any other patients. Click on Customize View. Scroll down to Orthostatic Vital Signs. Select the default open checkbox for orthostatic vital signs. Click OK. You'll now notice that the orthostatic vital signs have defaulted open. Keep in mind that default sections have already been chosen for each band in order to maximize your workflow. Changes will only apply to you and this patient. You have customized a section to default open when you log into iView. Now let's review how to modify documentation within iView. Modifying results. In reviewing the vital signs, you notice that you have entered the wrong value for the pulse. With a right click of the mouse, you have the ability to update, modify, unchart, change date, time, or add comments to your documentation. Disclaimer: do not modify or unchart another user's documentation. Let's modify and correct the pulse with the correct information. Right-click the peripheral pulse cell of 84 and select Modify. Enter the correct peripheral pulse rate of 74. Click the green check mark to sign the documentation. Remember, the Canopy system keeps track of the details behind all documentation. Do not modify or unchart another user's documentation. Now let's look at reviewing documentation in flowsheets. Review flowsheets documentation. During your shift, you want to review documentation that was completed by the prior nursing assistant or by other clinicians caring for 13 MRSA. Flowsheets are designed to make finding clinical information as efficient as possible. From the menu, click Flowsheets. Flowsheets are organized by various tabs and display information from a variety of sources using PowerForms, iView, and clinical results, such as labs. Similar to iView, the navigator appears on the left and the review pane appears on the right. All results are shown within the clinical date-time range. Right-clicking the gray bar allows you to change the search criteria. If the information is not visible for the date range selected, click Show More Results. Select the Vitals View tab. By right-clicking on any documentation, you can review details and comments. Right-click on the oxygen saturation. Select View Details. Review the details in the Result Detail dialog box and click Close to return to the flowsheet. Information within the Flowsheet tab can be viewed in a table, group, or list format. Click the Recent Results tab. The Recent Results tab has multiple flowsheet view options. Restrictive Interventions and Diabetic Record (FSBG) view are two examples beneficial to nursing assistants. Change the flowsheet drop-down to Restrictive Interventions view. You have completed how to review flowsheets. Now let's move on to the lesson summary. Lesson summary. This completes the Introduction of iView to Nursing Assistants course. Now that you have completed this course, you should be able to use staff assignment, use handoff communication page, document on a PowerForm, use iView to document patient care, document notifications in iView, modify, unchart, and change date time of documentation in iView. Learn how to personalize iView. Learn how to begin and inactivate dynamic groups. Document tasks in the Activity View band. Use categorization. Use flowsheets to review prior documentation. Please print your transcript from PeopleLink to show completion of this course. You will not receive a certificate at the end of this course. Please navigate back to PeopleLink to print your transcript.